Here we are starting our panel about from individual to collective self-research. And this is part of the Open Humans community call. So it is connected to our current project, the Keating Memorial Self-Research Project, but also connected to what we want to do more broadly within Open Humans. And so to start this panel discussion, I thought it would be nice to reflect a little on like why are we interested in self-research now? Open Humans historically helped people create projects that solicited aggregate data and group projects. And so to get things started, I thought I'd pose a question to Bastian. Why are we doing self-research? And like, how do you see these things connected?
Right. So I think the main reason why we are now switching from the group research to the more self-research is that we have seen in the past years with Open Humans how hard it is for people to start collective research projects. Getting people to agree on a single protocol to all collect the same data, it's really hard and the barrier is really high. While it's much easier for people to start individually. And I think we already see this in the Keating Memorial where Stephen is doing experiments around different effects of different food items on blood glucose, and Michael and I are trying to do the same here in Paris. And just for us three people to agree on one protocol, it's much harder than just doing it by yourself. And even Michael and I, before we even knew that Stephen would be doing a similar thing, were like spending a lot of time, like, what do we actually want to track? Which food items do we want to look at? So once you go from one person just to two, it becomes so much harder. And it's much easier to prototype and start doing experiments just by yourself. And I think that's the main reason why we are trying to support the self-research aspect much more these days.
So from this, I'm going to move into some of the bigger questions that I hope we can all discuss. And that is, and one of them is, you know, what is the transition from the individual to the greater self? It's to a greater group. And it sounds like one of those is about sort of sharing methods and refining and developing them. And maybe I'll pass this to Stephen Kaye since he's here as well. Have you had any thoughts about that process for you?
Yeah, well, and so this is something I'm just getting going on, and it's definitely proving to be one of the major challenges. And part of this is part of the challenge is to get sort of clean data, you need, you know, pretty careful protocols and really controlling for a lot of different factors. But when you're doing self-research with a group, everybody's got sort of different things going on in their life and different, and it's hard to put the same controls in place for everyone. So for example, in the, you know, in looking at the food effects study, for me, in order to get my blood glucose to stabilize, I basically have to not eat for the morning, and the correct window of time is, you know, about 12 o'clock. For someone else, depending on their lifestyle and whether or not they've got diabetes, it's going to be totally different. I saw this also in the shower effect study that I was doing with a bunch of other diabetics. You know, everybody takes a shower at a different time, can tolerate a different level of heat, different duration, willingness to run repeat experiments, things like that. And so we did the best we could, but there were a lot of methodological challenges. And it's something I don't have a great answer to yet. And I know in my work life where, you know, we do, I lead a team that does chemistry research. We do a lot of you know, collective discussions around protocols and keeping everything really consistent and harmonized. But it's a job, and we all work together, and I can basically enforce that as a rule for the group, and you can't do that in community research. So figuring out how to like establish norms, present things really cleanly so that people buy into it, that's something I'm still working on, but is very clearly critical to doing this well.
Yeah, it sounds like, in a sense, that methods have to kind of take the most conservative approach, and then as soon as someone's doing it for themselves, their incentive is to kind of cut corners and not do things that don't matter for them, and and you want to give them some huge conservative set of things, and they're like, well, to do this myself, I don't need to do those 9 things, just that one thing, except like the only way to standardize it is to say everybody do these 10 things.
Yeah. One thing I've been wondering is whether if, basically you have a, call it pioneering or sort of beachhead person who runs the experiments in a clean way, gets, reasonable, good data and a, standardized analysis, whether then people will like buy into that as it's easier to copy that than create something themselves. And maybe you can sort of inspire people to add in data. Don't know yet whether that's going to work, but I'm hoping the food effect study will do that, where as I collect enough data, start posting it in places where people are interested in these things, maybe I can get people to join in and copy the study rather than sort of, invent their own, but we'll see if it works.
Can I just, I guess, put some support behind that? We work in data collection in the open ag tech space, and there's a lot of similar issues with soil sampling. There's like 1 million soil sampling protocols, and no one ever wants to do it anybody else's way, even though everyone would be better off if they did. And yeah, I think the conclusion that we've come to is very similar, which is everyone is going to do their own thing, but if you can make everyone's thing transparent and easily accessible, it allows the best methods to float to the top, basically. And then over time, community builds consensus about the methods that seem to be preferable rather than enforcing a method. But sort of transparency and accessibility of methods becomes really important at that point.
Do you have any insight into like how you make those methods sort of clear and transparent? One of the challenges I've been having is, I have a standard way I write these things, which is based off of how people do it in chemistry, but that's not necessarily the most readable for a non-scientist. And I've been kind of struggling with what's the best way to communicate these things so that they're both very accessible to everyone who might want to participate, but also actually clearly and thoroughly lays things out.
Yeah, so we've been using like an Android app, which is now going to become a cross-platform app, which is like a survey app. Like Google Forms is a great way everyone can access it. You click on a link and fill it out. The problem is it doesn't automatically send it out on the dates when needed, or if someone's taking a shower and they're not thinking about it, right? It's the experimental design part that gets complicated. And also, it doesn't give you the kind of quality checking and sanity checking that you would need to really know, like, oh, they answered question 2 as yes, but they answered question 3 as no, that doesn't make sense, kind of stuff. Like maybe you should go back and relook. So we've been trying to build out software in collaboration with other people in the open ag tech community to like complete that functionality in a way that does the sanity checking and helps you implement across a wide range of platforms in a way that's kind of like several steps beyond something that's a Google form. I was going to ask that, like, how do you collect data? Like, is it survey type data? Is it from machines? Like, is it stream data? Like, I was just curious.
For me, I have not done that well on the first go around. So basically, the individuals will collect the data based on their blood glucose monitors, whether it was a continuous monitor or finger stick. But then we just literally posted the data in a Reddit thread, and then I manually entered it into an Excel sheet. It was fast to get up and running. I would not do it that way again. I would probably set up a Google sheet or something like that. Yeah, that turned out to be a real pain.
It's amazing though.
Mm.
Some of this is about convergence on tools. I've been learning a lot from others what tools they're using. But I think the answer to that question is all of the above, broadly speaking, and it depends on the specific self-experiment or self-research that people are doing. Like I use a self-survey tool where I can kind of configure the questions for myself, and then I can export the data as JSON or CSV. And Open Humans has a variety of apps and tools that enables automated import of data when that's available. So for stuff like Fitbit or even Spotify Music, there's APIs where you can authorize data flows. And so that when that's possible, that's possible. Sometimes it's not. Sometimes you have to like click a button, export a file, and put it somewhere else.
Cool.
I had a follow-up question for Stephen in that I think that it's, we've discussed sharing methods, and sort of the dream is that other people pick up the method and then do it. And then what's the sort of the next step of like the dream of what do you hope? I mean, there's always that possibility that there's lurkers out there that just pick up your method and go do it and never come back or tell you about it. What are some of the ways in which you hope it goes from there, where people bring back something?
I mean, my real hope is that basically people bring back that data, share it, and we can aggregate it together and learn things that we couldn't learn from the individual data sets. One of the big things as I was sort of planning out this food effects study was I was looking at the literature on different things like, what's the effect of vinegar, what's the effect of MSG that someone brought up, the effect of protein supplementation. And you look at this and the literature is suggestive but ambiguous. And it's largely because the number of people that have been studied is tiny. Some of these things, it's maybe a few tens of people and these single point measurements. And if you can get enough people participating, you could potentially actually figure out what's going on with these things and essentially learn whether these interventions are genuinely useful or not. Ultimately that probably leads to a randomized control trial of sufficient size to confirm it for the wider medical community. But I think you can gain that knowledge with these, call it community N of 1 studies. And so the hope would be that basically people would go out, do those studies, communicate the data back. If we had some nice, clean way to aggregate it and share it, that would be amazing. Right now, I'm hoping just the minimalist, just get the data back and individuals can analyze and learn.
What's your?
Oh,
sorry,
Bastian.
I was just curious. How many people do you think you would need? You say the studies have been done with tens of people. So how many would you expect to need for getting more general insight into the effects done?
Yeah, I think it depends. From my guess is you'd probably need on the order of something between 50 and 100 data points. That may not require 50 to 100 people, though. A lot of these studies were done because of the burden of having to have a person come into the doctor's office to do the study. There's maybe 1 or 2 point measurements for a given intervention. When you're doing it by yourself, I'm doing a lot more data points with a lot less work and cost than went into these studies. So my guess is somewhere between 10 and 20 people, but doing a more thorough set of measurements may be able to get you there. But it's something we'll have to see.
Yeah, I think that's a good point, that you don't need especially many people, but if you have just 10 people doing it for a really long time, you might get just as much data as you would get from 100 people who are doing it once in the more traditional research setting.
Exactly, especially if they're committed. Yeah.
It's also interesting to observe how it might learn something a little different, because it would learn something about individual consistency that you would never get if you did a big broad.
Yes, and that's something I'm extremely interested in. There's some studies by these guys in Israel, I'm blanking on their names right now, where they studied a very large number of people with continuous glucose monitors and saw individual differences in responses to different foods. But it was not a very thoroughly controlled study because they sacrificed that for very large numbers. I'd be really interested to see if we could pin down the sort of effect size of this individual variation and really understand those differences more thoroughly. I think that could be extremely valuable.
So I posted the link to the Open APS, and just generally speaking, I think when there's a popular set of devices or there's a popular app, even 23andMe, that's where you get the larger scale citizen science. But of course, all the control is on the corporate, not on the N=1. So I think there is larger scale communities, but they've done it through money or having a monopoly over the device or the thing. I totally agree with the, you know, this template, as I call it, and then you subscribe to it or join to it. So what I've been working on is modules. And so I think that's something as a community we could do. So I have existing knowledge module, the question module, the data module, the device module, the data type module, the computation module, the scientific review you've chosen for that module, the control mechanism you chose for that module, and then you have the ongoing evaluation or splitting the question. But I think we could devise modules which we could then through a graphical tool just pull together. And if it's not perfect for you, you just split it, but at least 90% of the standardizations sort of been baked into that workflow. Yes, I think that's the way to do it. As I said, you can do it with money and monopoly over devices, but you know, how much transparency we get on that is pretty much nil.
Yeah, I think the issue is often less than having like a standardized data collection. If you say 23andMe exists, Fitbit exists, OpenAPS exists, but the issue is if you don't have any standardized protocol of what you're doing, the data will not tell you anything. So if I have like, I don't know, 2 months worth of my continuous glucose monitoring data, but it was just collecting data in my natural life. It's just this background frequency, which doesn't tell you much. And the same for the wearable device data in 23andMe. You have this data that is easy to collect, but it doesn't tell you much if you have not a very clear protocol of the intervention you want to do in between. I think that's where the modules become really important, to have like this module to interact with the data stream you are easily collecting.
Yeah, I think it's the modules are the key, and what the detail is for us to decide, I think.
I might have a few insights too from the social process of engaging people, because when we did the blood cholesterol participant-led research project, we quickly encountered some of the issues that Stephen was talking about, which is that every increase in complexity of the protocol, even a small increase, immediately reduces the participation of the group. And I'll just use some shorthand to describe kind of our bottom line conclusions. And if they seem questionable, you can ask, but they may seem obvious. But that is that the open scientific workflows are very important for scientists, and scientific attention to problems that are tractable with self-collected data. You know, these are very valuable for making this kind of generalized knowledge that Stephen's talking about that just simply doesn't exist. But it only makes trouble for you to imagine that there are a lot of volunteer community participants who are going to invest personal time in mastering rigorous workflows to deliver generalized scientific knowledge. So in a sense, if you try to go too fast, you break it like right away. And then you end up with this problem to try to solve, which is really frustrating because it probably doesn't have a solution at the level you're working of like getting people to do the right thing or, you know, the bottom line for me was, well, the approaches, it's really two approaches. One is a really small group of like 2 or 3 or 4 people. And the reason it has to be small is how many people can you engage in your problem who actually have a strong scientific commitment and who really, they think scientifically and they want to do the work to deliver scientific knowledge to the world. That is a very, and in your area around your specific question. So then you can develop a protocol that really works for a small group and build confidence and also do a lot of hard work that doesn't end up panning out in the end because you know that's part of the job. It doesn't cause you too much pain. And then the other approach, so that's approach 1, and approach 2 is supporting people asking really diverse things in reaction to really diverse questions, following their own sense of what a right protocol is, which isn't going to generalize. It's going to have all kinds of gaps and holes, but they have some little bit of common protocol that then you can use as a scientist to learn something that may be important. So around blood testers, for us, that was, we'll take 1 fasting measurement every single morning. And it turned out that actually there wasn't a lot of data from people taking a blood cholesterol measurement every single morning. Like, seems obvious, but it's just not collected. Data isn't collected that way. And out of that came a paper showing that that time of day effects were pushed people across cardiovascular risk categories independent of diet. So, which was an important conclusion, and yet it came from just 1 tiny bit of protocol that worked. And in the meantime, people had all kinds of other questions. None of what they were learning was really scientific in the sense of generalizable. So, and just one final remark is that if you notice what kind of scientific knowledge we got, it was actually knowledge about variation. It was kind of, it wasn't really knowledge about like, here's an intervention that affects blood cholesterol or something like that. It was a much more sort of kind of meta knowledge about when you measure cholesterol often, you see unexpected variation that you wouldn't otherwise have seen. And that's important to have, but in a way you can see that it's kind of cheating. Like it's knowledge that shows we don't know as much as we thought we did, which is easier knowledge in a sense to find than knowledge of a dramatic cause and effect relationship that nobody had ever seen before.
I like the language of modules that James brought up. And it reminds me a lot of, and this is a pet sort of thing of Bastian and myself, of peer production, in the sense of like, how do other open knowledge movements work in terms of open source, open science, stuff like Wikipedia. And one of the elements is that there is some sense in which there's modules that are reusable. And so we break things apart. You don't have to reuse the whole thing, but you can kind of reuse this method or this tool or this piece of an analysis code. And so I think there is this intuitive sense that somewhere in this, there's pieces that we could reuse, even if we don't want to replicate the entire thing that someone else does. But the other observation I wanted to make is that in those ecosystems, especially in some place like open source, you see a whole bunch of people do individual projects, and like the vast majority of open source packages is like one person, and they share their code on GitHub and nobody else uses it. And that's okay, because it solved their own problem. And it's a natural, and there's an organic growth of adoption of projects. So in open source, the packages that take off as being popular are rarely imposed in a top-down way, like Google or Microsoft wrote this and then you take it. A lot of those packages take off because one person used it to solve their problem, another person saw that it was useful. And so I start to wonder, like, can self-research be the same thing? You know, is it okay that like most people do things that nobody else is going to want to redo, but some of them are going to do something that other people find appealing and reused? Do other people have that dream? Like, do you think about it in similar ways, or how do you think about the takeoff from one to many?
Let me give one more. I totally agree with what you said. One more analogy is look at co-ops. Like, you know, co-ops are implemented in different ways all over the world, but the amount of engagement in a co-op is very similar across them all, which is 95% of people just use the service, the base service, whatever the co-op is providing, if it's selling or equipment sharing or whatever it is. And then some very small percent, 2 to 5%, are actually engaged in the thinking process of the co-op. And that's like, that's okay. That's not a bad thing. That means a lot of value is being created, and those who want to engage can engage. It's just ensuring that the pathway to choose to be in that 5% who engages is open and available to everyone if they want.
So I'm going to bring a new subject up. One of the ideas that's been floating around is related to current events, and that's wondering about coronavirus or COVID-19, whether people can detect when they're sick or track symptoms. And so I think that Kate had mentioned in Slack that this might be, that this was an interesting topic. And so if I can be so bold, I'm going to pass it off to you and also kind of invite general discussion about this particular topic of symptom tracking and what sort of individual or group ideas we might have around it for the virus stuff. So Kate, to you.
Yes, thank you. So what happens is that I have a large keynote to medical community. I'm a computer scientist. I research in the area of digital health, and it's already the second time when I've been invited to give a keynote to hospital pharmacists. So they are the persons who are producing medications, individuals for the patient at the hospital side. But in my keynote, I'm invited to really stretch the limits of where the technology can bring us. So 2 years ago, my title was Star Trek, something with Star Trek and tricoder, right? And this year it's about what are we going to be treated by computers in the future? And actually then seeing the fact that we really are very vulnerable in these times, and the only thing which the experts are saying, just stay at home and watch your temperature and symptoms to go away, then I remind myself that I was sick 2 years ago. I'm not so often sick, so that also tells you. 2 years ago, I was sick, and I could see with a Basis watch increase of heart rate, specifically around the days when I was having the flu symptoms. But now quickly, I went back to my servers and my backups, and I know it's my own data, but it was buried somewhere, and I could see that 2 weeks before I already had an increasing heart rate from the baseline. So I had a very specific light protocol. I had meditation, yogas, and specific sleeping patterns. So I know that, and I could come back. I have very detailed idea where I was in this particular period. I was living out by myself. In a sense, I can trust that this data, but on the other hand, I don't want to make overpromise. So it's the temperature. I would like to hear if anybody used Basis Peak back then, which is not existing anymore, and also if you maybe now use any of those trackers and you can see something, and if we could somehow provide a message to community. It's very risky. I don't feel super comfortable with this because it's a huge responsibility of saying like, now be careful, but no. Watch out your own data sets and try to make sense out of it. And I don't think it's, I would need to, if I even present any case, I would need to be careful of how do I package it. Just wanted to say this. So I'm welcoming any feedback. So that was not specifically body temperature. There was some increase in body temperature, but then up to 25 beats per minute for night levels of heart rate. I'm not talking about resting heart rate, but really the whole night went up plus 25 points from what I had before, like 2 weeks before. Yes, any feedback is welcome.
So I guess one of the interesting questions around this is not wanting to lead people into thinking that they can do something that they can't, or into some sort of risky behavior, like I can monitor for getting sick, and it turns out that that's actually really hard, or maybe nearly impossible in the individual scale. And so you don't want to mislead people. At the same time, there's this intrinsic sort of spark of curiosity we have of like, if I do get sick, how does that show up, right? Like, how can we see all that? And I see Gary sharing a slide, so maybe I will pass it to you, Gary, as you've been thinking about this too. But I wanted to observe like this sort of, because this is this is a bigger picture issue around going from self-research to group research, is to think about, are you inviting people to take risks or misleading them in some way, versus like, you know, that potential for a community project, which is really exciting. Yes. Gary, you want to share what this is?
Yes, well, it might help with presentation for one thing, because that was your immediate request. And I also have had this challenge because I do think there's potential here, but it's not something where we have a product or a best practice anywhere within our sites. And so I think, why do we care about it? We care about it because we see the potential for this social movement of collecting and sharing data and doing self-research to provide large-scale social benefit. So we see the potential, but we don't have a product or a best practice, and we want to be very, very clear about that, or else it just creates disappointment. So I sympathize with that. And so we've seen quite a number of talks where people have presented either resting heart rate or body temperature as a sickness sign. And then also in that Physiomes paper that you were talking about, Chao Li's paper, there's a report of using blood oxygenation to anticipate Lyme disease. So we know that the signals are there, but we just don't really have a best practice for evaluating them. So I just basically, in my slide where I'm going to start talking about this, I use it just to represent the urgency of the work that we're trying to do, to say that these signals exist and we need the capacity, but that capacity depends on developing a culture of personal science so that individuals and researchers can collaborate. I think we can go further than that. This is really to introduce the idea, as you're going to people who are hospital pharmacists. They're not going to act on this idea probably, right away. They just want awareness. I think for our group, we do have the capacity to act on this idea. And, this is something that we probably would need 20 or 30 people doing a collaborative self-research project that lasted a year or two, because we need sickness onset incidents, right? And, but with that kind of data where, deciding on instrumentation, and then also having access to some analytical capacity, because in our work in other areas, it's not simply one signal, it's it's sets of data, and it's also, for instance, the rhythmicity, the correlation of these data and how in sync they are, these data types, that gives you a signal. So there's an analytical, you're not just going to look at some time series data and see,
that is correct. Yeah.
Here's my resting heart rate ran up, and I'm 80% certain to be sick within 24 hours. But I do think that capacity exists in our community, and it's a major result. If we had the ambition and the funding and the commitment, I think we could legitimately promise to deliver this result in an appropriate amount of time.
I guess one question would be whether we actually need to do this study going forward, or whether we can use data that people already have. So Kate says she already has historic data about having, knowing when she was sick. I have data of when I know when I was sick, and I have the data from my Fitbit or my Oura Ring, whatever, even for body temperature, heart rate, and so on. Can we find more people who might be able to go back in time, for which they already have wearable device data, and ask them just to provide us the annotation of when they were sick? Because then we don't have to wait for a year or two before enough
I
people
would love to coordinate these efforts right now, specifically for those of us who also have a detailed information about their past. For example, alcohol. We do know increases heart rate at night, and any party or arousal before sleep, right? Yes. So anybody, please let me know.
I'm going to confess, I don't think I kept good records on when I got sick. And so I'm impressed if people know the exact dates that they were sick. I'm kind of crappy. I mean, I've got the wearables because that's passive. But how would you suggest people record that? Like symptoms or sickness?
Symptoms, yeah. I mean, I think exactly that's how not often I am sick, so I know it. And I put it in my calendar. I do remember it, yes.
I'm always skeptical of human self-reporting, because we know that the brain makes up a lot of stuff. So even though I'm conscious and in the moment, we've plenty of evidence that in courts, in cases. So I'm always on the skeptical end, though try. One other thing that I call my project the DIY Health Science Project, because I think the DIY is a massive trend. It's just off to explode. And little examples like smear testing for women, low participation, but then they came out last year with a urine test you can do at home. So it's just every time you empower a certain group of society with a tool they can do themselves, they seem to participate more, and obviously the cost goes down. So I think we're at the cusp of this, but I think this is the major trend that's coming through, and it might be 3 or 4 people right now, Gary, but it'll be 30, and then it'll be 3,000 and 3 million, as the technology allows you to do it yourself and automates away all this technical data interruptibility, security issues we've got. The one thing, science journal I wrote was sleep seemed to be a 2-week predictive on you sleep more, and that was published in their journal. But like Stephen, I would say it was such a small number, I would discredit it, but it got into a top journal.
So I guess what I'm trying to say, it's in my case, what I was, when I was looking at my own data, it seems to be like an on one study in the past where I knew that all the other variables were fixed, and I knew my lifestyle, and I checked my times of work and exercise and things, and then I definitely knew, because back then I was very curious what happened, and I was presenting it a few times at quantified self meetups. Oh, I got sick, look at this, my heart rate went up. And then I found literature later supporting this. So yeah, I agree, but I also agree we have to start somewhere, and on one
like the ultimate scientific method is yourself. So if you can use that model and you work it works tomorrow, the next week, the weekend after that, it works the rest of your life, then you use it. But if I then took the model and it didn't work every day, then that's an issue. But if it works for you right now, you just continue to use it, right? So that freedom's always there. If it works for 30 people right now, you continue to use it. That's what I mean about forking the projects. You know, it's like you build up the diversity that way. But the great thing about the n=1 is your own outcome. So you'll continue to use it, and you know, okay, I'm sleeping more. Let's have it 2 weeks. I get a notification from my module. What am I going to do about it? And this is when the other side of the equation, can we do anything about it? Which is another set of collaborations. Can we design the drug or the meditation or the food protocol? And again, that could be different for all of us too, even though the inputs leading up to them are similar.
I think with this particular question, it's tough because you can't stage the intervention yourself. You're waiting passively for something to happen, and actually kind of probably hoping you don't get sick. But the thing I'm really interested in, instead of jumping all the way to the end about like aggregating data, is to ask like, what is the symptom tracking tool? Because I already have a lot of passive, like what are the tools to use to collect the data that would be relevant? Other than the wearables. Okay, so I got the wearables, but like what are the other tools, if people were even starting to be interested in this question, would they need to be doing to be tracking the appropriate data?
So I just put in sample. Hi, by the way.
Hi, Stephen. This is another Stephen Jonas.
Yeah. I just put an example into the chat of a talk given at the Quantified Self Conference in Portland in 2018, and it's from Valerie Lanyard. It was a very interesting talk. She tracks her workouts. She's pretty rigorous about it, and she does it all in Excel. And one thing she tracked was when she wasn't able to work out for whatever reason, and she would track that reason. And so the whole talk was on all the reasons she couldn't work out. And she had a section of the talk just talking about getting sick. And the analysis is pretty interesting. She found out that she most often got sick from visiting her family. I think it was like a brother or sister and their kids. But I gave the link to the talk, but also the screenshot of just what she tracked about her sickness. And this is all just like Excel, very, very simple, but you can see like what she's looking at, which is like the start date, the duration, describing the sickness, like a cold or a throat bug, likely cause, other notes. And then she actually, since it's Excel, she just puts in like days since last cold, so she has a sense of intervals between sickness, but very simple, but also a really lot of interesting information in there. And just one thing about, this came up before, just how you track these things. Like for her, she says that she keeps this spreadsheet open on her desktop all the time. It's always open. And so that's just like one small trick.
Yeah, that's like, I've been doing that myself for medication tracking. It's just like recording it in a spreadsheet, like time. And it's low tech, but that's kind of where a lot of people are right now, I guess. Is that where everyone else is too? Like keep a spreadsheet open?
Yeah, I have 12 different Google calendars, and one of them is for this interesting observations, including dreams and some aspects of not feeling well, or I mean, it doesn't happen often, but there's one of 12 which is just for this personal notes, which is hardly visible in I mean, I'm not making it public or something, but then you can export it into any Excel or something.
That's really interesting because I've never thought about using Google Calendar. So you mark an event in the past, like that something happened?
For a day, right? So today, if I came to work and I had a really crazy dream, so I put dream 2 dots, and then at some point, if I export all the data from this Google Calendar, then I will be able to filter all the dreams and maybe do some analytics of keywords or whatever.
One of the things that we work with a lot of farmers who are probably even more reticent to put in data than anybody that you guys work with. And we find that, you know, if you say, hey, if you're trying to say, you know, when did you do this tillage operation, right? The simplest thing is just to have them put it in when it happens. But no one ever wants to put information in when they happen. And so what we found was the best like intermediate solution was to basically automatically send them like a weekly survey in which it sort of asked all the relevant questions on a weekly basis. So if you don't have information that's ultra time sensitive, where they could be off by a day or maybe some hours, that's kind of like a good way to not overwhelm people and still provide them with like an efficient kind of data collection experience.
So it's a push versus pull, right? So the
exactly.
Yeah. So for me, I'm pulling it. No, I'm pushing myself into the system as I hear all others as well. Open Excel file and specific ways of inputting some notes just before you forget. While you're talking about the pulling it from them, reminding them to note it. Yes. Yes.
Yeah. Yeah, I mean, I think what you described as a spreadsheet is like ideal. It's just a question of how many people, you know, have that kind of have that. We'll do it basically.
I think like if we were to try to do something together, a really simple, push sampling method would be a good technique to use. I mean, it's proven to work, and I've been using one that Mad recommended, iMood Journal, which is to keep track of mood for a project. And I actually started to use it to randomly sample my Tremory score, because I just needed a random but frequent sample during the day, and it was already programmed to ask me my mood. So I just used that as a trigger to record my Tremory score. And it works quite well, you know, as long as it's extremely, extremely time efficient.
Yeah, that tool works in part because the interface is so easy to use.
It's so efficient.
It's like, yeah, it's just like this. It's like hit a button.
It's as easy to record the score as it is to dismiss the notification. And I think that's that's like the key.
Exactly, yeah.
Yeah.
So you click faster than you can think about the answer. So it's also like the reactivity is less reactivity in respect to the fact that you just click the button.
So something like, are you sick? This is a very simple query.
Or did you get sick in the last week? And then the answer no is fast. But if you did, you're probably motivated to say, oh yeah, I did. And let me tell you about that. But if
you could have another question. What day did you get sick?
I think if it actually did happen, you're probably willing to put more work into it, but it needs to be super easy to just say, nah, no report. But that sounds a lot easier to me than like having a spreadsheet open.
I honestly think like if we wanted to conceive of a collective self-research project, we have enough knowledge to specify a data collection protocol, including the biometric data, in terms of like what's available state of the art. That doesn't mean it's practical to implement, you know, but I think we have enough knowledge to scope something like that.
And we are motivated enough to.
And it's very urgent today. You know, it's something where everybody recognizes that this would be a good kind of knowledge to have.
Yeah.
Well, I'd be interested. Our meeting is nearing an end, so I guess a question would be, if we are interested in this, some subset of people here, what would the next step be? I think one of the next steps is that somebody has to step forward and say they're going to kind of run a thing, and at which point everyone kind of takes one step back.
No, I can take it. I feel responsible as a community. Seriously, when I was thinking about my keynote in 2 weeks, I was like, how I can, it's, I feel ashamed. I don't have anything specific, like really seriously like bulletproof, you know, standing there last 2 years ago, 3,700 people. Maybe if one person picks up something out of this, that there's hope. But now it's not ethical to like pull a few graphs and say something. I feel so
cool.
Weird.
That would be great.
Yeah.
And
yeah.
Kate, my recommendation to you, if for next step for you to, since you've not stepped back, since you stepped forward, is to organize regular meetings. I have like a whole series of notes I took on like how things get started as like small scale governance or running things. The most important thing is regularly scheduled meetings.
Okay.
And from there, everything else falls out.
Yeah.
Like you don't do that and everything falls apart. And so that's my number one tip is, I guess, for you, if you'd like to run a group project, to schedule a meeting and then people who are interested to join. And I'll make an effort to share and to disseminate that.
Great. Okay. And I will go into. Yeah.
I will just reassure you that there will be at least one attendee at your meeting. So I'm glad to help. With just
me too.
Thank you. And if you want to pull any existing data sets for you, and out of curiosity, we could compare the notes. Just let me know. Yes.
Yeah, I think this is actually one thing which we could decide on then as like a first step, whether this should be prospective or retrospective. Because actually, if you speak in front of 3,500 people, how many of these people will have any kind of variable and might be able to recall when they were sick to actually make a retrospective study? This might actually be a call to action for those people in the room.
And I would also say, even though this is mainly for our next meeting, Kate, that you organized, but I think the retrospective work is a very good preparation. Whether it works as entirely or gets used, it will get us somewhere. So we might as well have that in a sense be our first step.
Thank you.
I was wondering how many people are taking vitamin D3 and zinc, because both are supposed to prevent the flu, and I've been taking them regularly. And that might be an interesting little test just among this small group, those who take it and those who don't, and how much they take it. So if somebody could set up a little Excel spreadsheet and we could all add in our what we take and how much we take, and then after 6 months we'll see if we get the flu.
I would say even better would be somebody taking it a month and then going off it for a month and then taking it for a month and then going off it, and then over years recording whether or not they're getting sick because they're controlling, there's their own control, right? The problem with trying to do it in a group is that we all have so much variation in our exposures and whatnot. But if one person is switching between those two protocols, I bet they could actually build up like that over time, individual. So that's my suggested improvement to the protocol.
Well, D3 is actually stored in your body to some degree. So going off and on each month, I don't think really applies very much. Maybe this is one of the reasons why they think the flu goes away in the summer. You get more D3 through the sun, and therefore the exposure is less. So whatever.
There's a book. Oh, I can't remember what it's called. Well, it's called Self-Experimenters. I can't remember who the author is, but it's basically just like a log of all these different self-experiments he found like in history. It's really fascinating. You see a lot of experimentation with cocaine in the late 1800s. But another thing that you see is epidemiologists trying to understand how diseases are transmitted. And these are honestly like the bravest people I could ever imagine, where they're basically consuming different bodily fluids from sick patients to find out. 1900s. Yeah, to find out like, oh, can you transmit the disease this way? You know, and I won't detail the different bodily fluids, but like, you know, it's.
I could never finish reading those articles.
Yeah, but what I'm saying is, you could just wait months and years, or you can find someone who's sick. You know, have them cough on you or collect, you know, some, and, you know, so there is that extra level you can always go to.
No, you're not really encouraging people to take risky behavior, but you're just observing that risky behavior is entirely possible.
Exactly.
I think we can.
Yeah, there's a history.
It's enough for us just taking the tea and things like that.
Yeah.
Subway.
I think that's a great signal for me to say this.
I think we're going to have to wrap up. We're running a little late, but this was really fun. Thank you, everyone, for who participated and was here. This was really a wonderful discussion. And I hope everyone has a great day, great evening.
We continue. Yeah.
Bye.
See you next month.
Okay. See you next month.
Thank
Bye-bye.
you. Stay not sick. Stay healthy.